Colleagues will start in about 2 minutes' time. We'll just settle down.
Sorry, we've just given an address in the house, and we confirmed the existence of a patient who has tested positive for the COVID-19 virus for the first time in the country. And this patient was identified in the province of KwaZulu-Natal. An individual, excuse me, who had come from Italy and came through our borders when he had no symptoms and there was no problem whatsoever. And the symptoms developed about 3 days after his return. And this, the individual went to talk to the general practitioner, who responsibly took the necessary test and then asked the patient to be on voluntary quarantine pending the outcome of the results. And in this case, there was not much cough, but the patient was not feeling comfortable, as I've indicated some of the symptoms. So it was not necessarily very severe symptoms, and it could have been an ordinary common flu. And with the test coming to be positive now, we've actually notified the provincial head of departments and the MEC about this matter. We have also made sure that arrangements are made for the patient to be taken to the center where they will be treated. We have identified or designated hospitals for this, so that treatment is going to take place in that particular area. We are therefore going to be dealing with the members of the family and taking them to the necessary quarantine. We know those who could have been exposed to him will seal that, in a kind of web network that will be able to give us all those that must be checked, and then we move on. So if there's another new case, we'll also want to do exactly the same. I think what we have learned from China is that speed, decisiveness, and unity of everyone and acting in unison becomes a very important issue. And in this case, we really hope that we will get everyone working with us in dealing with this issue.